Yeah. So I think that the Affordable Care Act has been a winning story for everybody. And one of the things that you were just mentioning about, somebody just writing that, we're going to cover all pre-existing conditions is great to put it on paper like that and to give it some sort of time and speech. But what's really important is that we have to recognize that we will never program or speech our way out of problems, that we all recognize that sustainable change comes through policy and legislation, which is what the Affordable Care Act gave to all of us. And that there is very little doubt that invalidating the Affordable Care Act in a whole or a large part would have a dramatic effect on the nation's health system. And not just for the 20 million people Americans whose coverage is directly impacted by that law, but we also know that there's billions of dollars that are invested from the private sector and the public sector that impact all aspects of the American healthcare systems, and that invalidating that law would upend those expectations, those healthcare expectations that people now have, and throw our economy, frankly, into chaos. And that the health law that directly affects Americans who purchase their own insurance through these exchanges, that's about 10 to 12 million households. But those protections, the insurance protections in that law, also protect those people who have insurance through their jobs. Those provisions include things that people don't necessarily think about, but they include like allowing your adult children to stay on their parents' health plans, like you were just talking about. They require insurers to cover people who have those pre-existing conditions, and that's part of policy, right? That's not just speech writing, that's part of the policy. But it makes sure that people's pre-existing conditions are covered at no additional charge to those patients. And frankly, the older as people get, the more likely they are to have a pre-existing condition, right? I mean, you can call almost anything a pre-existing condition. For the many women in my field who end up having C-sections, that ends up being a pre-existing condition for them, for instance. And so pre-existing conditions are actually something that a lot of Americans experience. And then that law also requires that the ACA compliant policies provide preventative health care with no out-of-pocket costs and bans annual and lifetime insurance coverage limits. And why that's important is because we all know that preventative care, it does exactly what it's meant to do, exactly what it says. When you are doing preventative care, that means you're trying to stave off future long-term chronic healthcare problems by catching it early and preventing those things. And that in and of itself is a huge cost-saving measure that goes along with the Affordable Care Act. And so the other thing is that it also limits insurance amounts of profit and administrative expenses, and that's really important. And so most people with at least a passing familiarity with this healthcare law know that Medicaid program got expanded in those states that allowed for it to happen. And what we have found out since Medicaid expansion, which South Carolina did not do, is that those states that expanded Medicaid have had better healthcare outcomes because of Medicaid. And what that did is provide people in a certain category of lower income with health insurance, which included those preventative health care services, which meant the disparities that were part of some of the health inequities that we face in our state, those things would have been taken care of, so that when our population, if we had expanded Medicaid back at the time when we had the option to, that when this pandemic hit now, our population of people that has been disparately being affected by COVID would have been able to have been in a healthier place at that point in time. And I think that's really important to note, that that decision at that point in time affected how those people were able to manage the suffering and the hardships that have come along now with the pandemic. And that is just one example of making sure that preventative health care is actually part of our insurance plans, because there's a number of things with the Affordable Care Act that are important for people to recognize, even if it doesn't directly affect them. There are provisions even in their insurance policies that make it so the Affordable Care Act is actually really important and beneficial to them. We know that preventative care on the outset becomes more expensive because you're actually looking into problems. But then when you are moving that forward into the future, you're actually saving money because you're preventing some of the outcomes that could happen with chronic illnesses. And we know in South Carolina that the issue of healthcare and who is going to pay for it is definitely important to South Carolinians, but we're also one of the nation's poorest states and one of its unhealthiest. We have high levels of obesity, we have high levels of diabetes, we have high levels of asthma, higher levels of maternal mortality. These are things that would be addressed by having a better healthcare system in place and being able to use those funds, because we know that South Carolina sits near the bottom in national rankings in measures of healthcare costs. Excuse me, healthcare access is one, but healthcare costs were actually one of the highest, and poor health outcomes. So it makes sense to me that we would do everything that we can to maintain people's access to healthcare through this.